The psoas muscle can be a major cause of back pain, and today I'm going to show you a very simple release technique that you can use to release the psoas and relieve back pain. Hi, I'm Dr. Dave Candy, and before I show you this psoas release technique, it's probably important that you know a little bit more about the psoas muscle, why it can be a cause of back pain, why it's not the most important cause of back pain, and then what you can do to address both the psoas problem as well as that more important cause of back pain. Now, the psoas muscle is actually part of a muscle called the iliopsoas. And the iliopsoas is in itself one of several hip flexors. Now, the iliopsoas is made up of two parts, the iliacus, which attaches to the hip bone or the ilium, and the psoas, which attaches to the spine. And because the psoas attaches to the spine, it often gets a really bad rap as being a major cause of back pain. And it can, in fact, cause back pain. And this release technique will help with it. But the more important factor is, why did that psoas get stiff or tight in the first place? Because if you release the psoas using this technique, it'll help for a while, but you need to find the deeper root causes that will keep that pain from coming back. So to actually do the psoas release technique, you're going to lay down with your knees bent. So lay down on a bed or on the floor, and then you're going to take your hands and kind of press through your belly. The psoas runs from the hip up to the belly button and the spine. So you're going to kind of press between your belly button and the hip and just gently apply a pressure. Start very superficial and sink in deeper and deeper and deeper. And you should get to a point where you start to feel like a little bit of tension build underneath your fingers. Now, I highly recommend that you use the bathroom before doing this, because you can put a little bit of pressure on your bladder when you're doing this. But you want to dig in until you feel a little bit of tension and move around to a couple different areas in your abdomen. And when you find one that's a little bit tender or a little bit sore, just kind of hold that pressure there. You don't want to press as hard as you possibly can. It should be just a gentle pressure. Then take a couple deep breaths in. And each time you breathe out, you should be able to sink just a little bit deeper into that muscle. Now, there may be various areas, if you press around the abdomen, where you find a couple different areas of tightness or knots or trigger points. There may even be some in the iliacus, right by the hip bone and inside the hip bone, which I recommend you check out as well. And then, once you find a spot, just take a couple deep breaths. And allow that pressure to sink deeper and deeper. And after doing that for 5 or 10 minutes and finding a couple different of the trigger points, you should notice when you sit back up that your back is feeling a lot better, that your hips don't feel as tight. And that'll stay that way for a while until you go back to whatever was causing the hips to be tight in the first place. And that's really what we try to find out. What are the things that not only caused your back to hurt, but what are the things that got them there in the first place? In this case, what caused the psoas to become tight? So that's all for the video today. If you have any questions, feel free to reach out. And if you like this informational video, we have a lot more that come out like this. Follow us on Facebook or subscribe to our YouTube channel to stay up to date with the most recent posts.